Hello everyone. Today we'll be discussing about iron deficiency anemia. Now, iron deficiency anemia is the most common anemia in India and world, but in elderly population it is second most common. The first most common anemia in elderly is the anemia of chronic diseases. Now, causes of iron deficiency anemia, we have basically three causes. Increased demand of iron, second is increased excretion or decreased absorption of iron, the third is malnutrition or dietary deficiency. Now, in case of increased demand of iron, we see pregnancy, lactation, infancy. In case of increased excretion or decreased absorption of iron, we see post-gastrectomy, diseases of gut, malabsorption syndrome, and Crohn's disease, right? Now, the factors which increase absorption of iron is vitamin C, amino acids, sugar, citric acid, and hydrochloric acid or acidic environment. For decreased iron absorption, we see tannic acid in tea, phytates in bran, oxalates, phosphates, alkalosis like presence of pancreatic juice. A loss of iron can be due to acute bleeding, chronic GIT bleed, which is the most common cause of iron deficiency anemia in elderly, menstruation, most common cause of iron deficiency anemia in women, and hookworm infestation. The third was malnutrition or dietary deficiency in children during growth spurts, mainly in low-income groups. Now, let's see some clinical features of iron deficiency anemia. The first, we'll go for the general features of anemia. There is general pallor, sclera is pale below lower eyelid, anxiety, breathlessness, low work potential, always fatigue, less than adequate brain development in children, tachycardia, palpitations, systolic flow, murmur. The second is some special features, which is thinning of hair occurs in iron deficiency anemia. Reminding you people over here that early graying of hair occurs in deficiency of vitamin B12. Koilonychia, spoon-shaped nails, pica, that is craving for non-edible items like mud, clay. Patient gets extreme and repeated infections, mainly cold infections, angular cheilitis and atrophic glossitis.